The next massage reception that we will analyze is rubbing. Rubbing is the sliding of the hand of massage therapist with a displacement of the patient's body. Skin stretching is performed in various directions. The speed is rubbing will depend on the nature of massage, on the area of application, and in general on the indications of massage. Rubbing affects the ligamentous apparatus, joints, muscles, enhances blood circulation, reduces pain, increases muscle tone, helps stretch scars, adhesions, reduces the central nervous system, excitability, and warmth. Rubbing is the main effect of the body. The goal of rubbing is to provide high-quality warming for future massage. Rubbing can also be divided into main and auxiliary. Let's start with the main rubbing techniques. The first is alternating rubbing for the skin. It is performed as follows: the muscles palm are laid on the surface of the body and alternately move in different directions. All methods of rubbing can be performed in various directions, without thinking direction of lymph flow and everything else. The next main rubbing technique is spiral. Spiral rubbing be performed with 1, 2, 3 or 4 fingers depending on the size of area. It is performed as follows: the masseur's hands is placed on the patient's body and spiral movements are made from the thumb. If the area is small, then spiral rubbing is performed with 1 finger. Another basic rubbing technique is circular. Circular rubbing can be performed in different parts of the masseur's hand. It can be the base of the palm, fist, or flat palm, that the movement on the hand is made in circle. There are all the main tricks. Now let's move on to the auxiliary ones. The most common auxiliary technique is sewing. The palm of the massage therapist take on the flat shape. Sewing movements are performed with the edge of the palm of the hand. This technique is most often used on large flat surfaces. The next technique that we will deal with is planning. This technique is quite tough. It is done as follows: the masseur's hands also take such an even shape, straight, the thumb is retracted, and with the fist of the other hand we can hold the thumb, and with such movements we produce planning. You can do this with one hand. The second hand is needed for entrance the impact, so that the reception becomes more powerful. The next technique is quite soft. It is called hedging. It is produced small areas. In the following way: movement on the fingertips, we shade some area. Another technique that is used on round surface, limbs, on the surfaces on the back, abdomen or chest is intersection. It is performed by the radial surface of the hand. In this way, the hands move alternately in the direction. The next technique that we will analyze is comb-like rubbing. Comb rubbing is performed by a fist crest. It is performed as follows. In contrast of stroking, it is performed more quickly and intensively and in various directions. Also quite thus intense reception. There is another trick. This is a rake rubbing. By analogy with a rake-like stroking, it is performed on the same areas but in both directions more quickly and intensely. The next technique is forceps-like rubbing. In general, it is similar to forceps-like stroking. Fingers take the shape of stones. It is used in the same areas where forceps stroking is used, but in more different direction and more intensively. Another rubbing technique is S-shaped rubbing. This is well used along the spine. How it is done with your thumb or other fingers. Like a snake, we go around the spinous processes of the vertebra and rub the intervertebral space. Very good reception, especially for diseases associated with the spine. Where we examined all the main massage technique of rubbing. I hope everything is clear and we can move on.